Hello there. Welcome to Collaboration Wednesday, brought to you by the Grunin Foundation. I am Jeremy Grunin, president of the Grunin Foundation, and I am very, very happy to be joined today by Dr. Ken Sable. He is the regional president of the Southern Market for Hackensack Meridian Health. How are you today, Ken?
I'm doing great, and thanks for having me on.
Oh, thank you so much. I know it's been you guys have been a little busier than usual, so it's probably hard to carve out some time now.
What makes you think we were busy? Is there something going on I should know about?
No. You'll probably know when you get back into the office. You'll probably, or when you go back out to the floor, maybe you'll stumble on it. But
right.
Seriously, I mean, you guys have done such an amazing job. You know, you have to really be living under a rock to not see healthcare professionals across the country that are stepping up and doing amazing things. And you know, I like in New York City having that 7 p.m. I guess it's tradition now. Every night at 7 p.m. everybody comes out onto their terraces and just cheers for the first responders and the healthcare professionals. But personally, you have 3 hospitals, correct? That are under your purview.
3 plus the Children's Hospital, right?
Oh, that's right. So, what has been the biggest challenge for you really during this pandemic?
Well, I mean, I think the biggest challenge is that this is a once in a century event, right? And so, you know, who really prepares for this to happen? When this first came out and we heard about reports from China back in December and early January, everybody said, well, this is probably a form of a flu. Patients who are generally healthy will have a mild flu-like syndrome, and it'll be business as usual. Those who are 70, 80 and older and with comorbidities are going to be at higher risk. What's crazy is that what we're actually seeing is very different. In addition to those populations being more susceptible, we're seeing very young people, teenagers, 20s, 30s, 40s, otherwise healthy individuals not only contracting the disease but having a pretty significant course. Some very healthy 30-year-olds that required not only ventilation but ECMO, the extracorporeal membrane oxygenation, which is something we see more in cardiac surgery patients. So I think for me, it's the biggest surprise and what we were not expecting was just the level of contagiousness of this and the level of acuity that these patients present with.
Yeah, that's I can't even imagine what it's been like, and having to, I think people forget, obviously not you, but so many people also forget that while we have this going on, oh, by the way, other people are getting sick as well, and then they get into the hospital, and you have to really kind of bend over backwards to make sure that they're not kind of cross-contaminated or that they're not exposed to this. Right. As you're trying to treat them for something else. I mean, how are you handling that?
Well, that's a great question. I think, there's good and bad news to everything. The good news is that when we first started, down this road and we were starting to get hit and the stay at home and the social distancing orders were coming, people were staying home and, they were not coming to the hospital. So after, probably by early April or end of March, the only thing we were seeing really was COVID patients coming into the hospital, or people with respiratory distress or cough or fever and things like that. So for the most part, people stayed home. Unfortunately, there's a downside to that as well. Patients, and we're starting to see some data on this, that with the death rate from non-COVID related conditions has actually gone up. People are, a little bit concerned. They don't want to come to the hospital for their chest pain, or maybe they're having symptoms of a stroke and they feel, you know what, I don't want to take a chance and go to the hospital and be exposed to a COVID patient. So instead, they just stay home. So, that's one of the downsides of it. I think for us, the hardest part is just the accessibility to testing. In a perfect world, if we had access to testing, rapid access to testing with results in minutes, which is what we're starting to move towards, we would be in a much better position, right? Because we could test everybody as they come in and then cohort them appropriately to COVID or non-COVID units. When we first were in the midst of this back in March, we were all fighting to get lab tests back from anywhere we could get them. I had found a lab in Virginia that was able to help for a few weeks or so. until Quest came up with their Teterboro site. But even then, the turnaround time was sometimes 5-7 days or longer. So, that was probably the biggest challenge, I think, initially in terms of what, your question was.
Give me an example of, if you could, because this nobody, as massive as the hospital systems can be, and as many folks as work there and are contributing, you can't do this alone. You can't do what you're doing without the help of others. So talk to me about some of the partnerships that have formed, maybe some that you had previously that have really stepped up, or some that are just brand new that you hadn't even considered that now are part of the fold.
Sure. One of the things that really became evident to me was the power and importance of a large network. So just talking for a minute about internal partnerships. Some of the smaller hospitals or even smaller hospital systems that didn't have the breadth and depth of resources that, for example, a Hackensack Meridian Health has, would struggle significantly more than we did, whether it's securing personal protective equipment, or what we found actually the biggest benefit of the network was being able to work internally with our other hospitals to be able to move patients around. It took a little bit of time before we set up regions between the North, Central, and South in New Jersey. And before that time, though, we were able to move patients from some of the hardest hit hospitals, for example, up in Bergen County, like at Palisades, all the way down to Jersey Shore, Ocean, and even Southern Ocean medical centers. So that was a big help. The other thing that was a big help was just kind of the brain power of everybody. We had to do certain things and use our resources for creativity and ingenuity. I'll give you two examples. One is that our chairman of anesthesia across our network all got together and created standardized protocols for how to convert the operating room anesthesia machines into ventilators. This was when we didn't know if we would have enough ventilators for the surge. Another major contributor was our facilities team. Across the network, they got together and they were able to convert hundreds of rooms, patient rooms throughout our network, into negative pressure isolation rooms by just simply utilizing fans that would suck the air out and exhaust it out to the outside. They had to take out windows in rooms and build in these fans into like a plexiglass or wood frame and put it back into the window framing. So those are the kind of things that were really amazing. The other thing is we were looking for where we could store equipment and have a central staging. So in our Hope Tower, we have an 8th floor that's a shelled space at Jersey Shore, and we were able to use that for the entire network. It's 30,000 square feet, and that became our basically de facto warehouse for storing all of our supplies. So those are just some of the internal partnerships. I'm certainly happy to talk about some external partnerships as well.
Yeah, that's great. I think it's and I'll put it into my own what was my hyper local experience when Community Medical Center first became part of the Robert Wood Johnson or at the time the Barnabas Network. There was concern that they're going to be part of a network and it's going to lose that individual feel, and it's going to and the talking points were very similar to it's the power of a network. It's like you have the ability to send a patient to the right spot for the right procedure, right? And you have the ability to really have folks kind of caucus on what the right answer is. You could take best practices and spread them across a whole network. And we've definitely seen that pre-pandemic, and I think now it's even more highly illustrated as the poop has really hit the fan, so to speak.
Absolutely.
So you teased it out for me. You threw me the alley-oop, so I'm going to send it in for you. Talk to me about some of your external partnerships and external collaborations.
Sure. So, there's so many to name. I can't even, cover them all. But, I think at the highest level, from the state, working with the New Jersey Hospitals Association, I'm a board member. We've been able to work collaboratively between the New Jersey Hospital Association, the Department of Health, the New Jersey State Police to coordinate for PPE donations. We worked on creating a formula to distribute allocations from the national stockpile of ventilators and PPE that would go out to all of our hospitals. We did a number of things like that. I think more locally, we all just came together. Bill Arnold, who is my counterpart in the RWJ Barnabas Health System, who covers the Southern Market and Monmouth Medical Center and community and the Southern Campus. He and I have, been very closely in touch on how we can help each other. He needed something, and I called a contact and put him in touch so he could get, I don't know if it was gowns or masks. He then called me back and said, I have a connection on face shields, and would you be interested? And I said, absolutely. So we've really been working well together. We also sit together on the New Jersey Hospital Association board. He's a great guy, and I think what really matters is that when there is a crisis, people do what's right, and leaders do what's right. And what's right is to take care of our team members and to take care of our patients and the communities that we serve.
100%. I think, it's for those of you not really kind of hip to the healthcare model, we've been talking now for a number of years about an evolution, a metamorphosis eventually of funding for hospitals that's based on healthy communities and not based on individual procedures or billable events, which is makes so much more sense. And frankly, the rest of the world's already ahead of us on that one, because we spend so many dollars on after somebody gets sick versus how many dollars we spend on keeping someone from getting sick. So really, ultimately, I think that kind of partnership is something that's mutually beneficial for both systems, and is, because you have so much crossover of where folks go between the two systems. We have so many great hospitals within a relatively small footprint. So that's really great to hear that you guys can work like that.
I couldn't agree more. And I think, the move to, move away from fee for service and to value-based compensation is going to require all of us to, work hard to keep our communities healthy. And that's how we will be reimbursed in the future as well.
So, I guess a question for you is, when we talk about collaboration, and we talk a lot about it in the nonprofit world, probably more so than we do in the for-profit world, because, obviously in the nonprofit world, we're not trying to make a better burger. We're trying to solve an issue, to fix a problem, to make the world a better place.
Right.
Which isn't to say that a great burger doesn't make the world a better place, but you know where I'm coming from. So one of the things that people, I think, steer away from in terms or get fearful of in collaborations is pride of authorship, right? Is the egos in the room. Have you found that at a time like this, when it's really critical that we have that kind of partnership, do you feel like that's kind of out the window and people are much more open to working together and not being concerned about who's got the first title on the letterhead?
Yeah, I would say 1,000%. In my interactions with all the various people that we partner with, both local competitors that I just mentioned to labs across the country that we're working with, to other vendors, people are doing the right thing. And I think, aside from the price gouging of PPE that's gone on, the most leaders and ones who I've worked with are absolutely doing the right thing. They understand the importance of community. They understand the importance that this is a pandemic, and the importance that we need to place our patients and our team members absolutely first. And they're doing that. And, I think it's a really, it's a testament to, being a human being. And when it hits the fan, the real leaders step up and lead and put all that ego stuff behind, and they do the right thing for the people that they're serving.
That's great. That's great. So what advice would you give to a smaller organization, a smaller, whether they do healthcare, whether they do, mental illness, whether they work with kids, whatever they may do, what kind of advice would you give to that leader that's just kind of fearful about picking up that phone and reaching out? I mean, how do you, some people I think there is kind of that insular nature, or that fear that they're going to, be marginalized in a partnership. What would you tell those folks in general?
So the term pay it forward is a term that you're probably familiar with. I think many of us are familiar with. I think that's extremely apropos to what we're talking about today. And for anybody who's concerned about that at this point, pay it forward. Do the right thing now. It will come back and reward you in spades later in some way, somehow. The universe has a way of doing that. But I think, now's not the time to be concerned about, who gets theirs and what's mine and what's yours and who gets first authorship. That's not important right now. I think what's important right now is to keep the focus on what we're here to do, and especially in healthcare, is to take care of our patients and our team members and our communities. But in any business, there are constituents and customers that you're going to want to take care of regardless of what your business is. Do the right thing. Do the right thing, and I think that people will reward you for that when the time is right.
That's great. So, listen, and you've been so gracious about giving us some time today. Thank you so much. For in the last couple of minutes, what advice or what would you say to the tens and tens of thousands of people that are going to watch this on Facebook and YouTube and wherever else we post it? What would you say to the folks of Monmouth and Ocean County that have been that you've been working with over these last certainly 2 months?
Number one would be thank you. Thank you for staying home. Thank you for socially distancing. Thank you for allowing us on the front lines to do our jobs and to make it easier to protect you at home and our communities that we serve. We will get over this. We are starting to see some progress, so there's hope. It isn't going away, and it's we don't talk about life after COVID. We talk about life after the surge with COVID. This will still be here until we get a vaccine or more reliable therapeutics that are backed by science. But continue to do your part. You are making a difference. You're helping. And continue to support the frontline team members. I think one of the things that I want to convey is something called the second victim syndrome. And, we're starting to see, after 45 days or more of this, frontline team members are dealing with post-traumatic stress type symptoms. We recently saw in the news an emergency physician. I'm an emergency physician, but one who worked in New York City recently took her own life. Due to the stress of taking care of so many COVID patients and watching them die. Just feel for them. They're going through a crazy ordeal themselves, mentally, physically, every single day. You've been great. Everybody's been great at the outpouring of emotion. The number of donations that we've gotten from everybody, people I went to high school with in Marlboro and everywhere else, giving us protein bars and food, and somebody I went to high school with is donating paintings in the honor of nurses and other healthcare heroes. Continue to do that. That is just lifts the morale of people, helps them get through their day. And as I said, I'm confident we're going to get through this. And thanks to all of you for being there for us of support.
Dr. Ken Sable, Regional President, Southern Market, Hackensack Meridian Health. Thank you so much. I am so jealous, by the way. I have letter envy because you have so many letters after your name, and I have nothing. I'm just Jeremy Grunin, and it makes me feel sad on some level.
You want to trade places?
No, I'm good. I'm going to go back to my couch and watch Breaking Bad. So thank you again. And thank you to everybody that's watching. We'll be back again next Wednesday for our next collaboration Wednesday. Thank you again, Doc.
Thanks, Jeremy. Take care. Bye-bye.
Take care.